Very good case. Excellent. Beautiful job.
Would it be helpful if I do lectures to doctors in the United States for this kind of technique?
And we don't have as much experience as someone you did, as someone like yourself, which you've done many more motivas than we have in the US.
The surgery finished.
You did amazing. I loved it. You did it. The game plan was precise. We did what, we discussed what would be the game plan and you did it all. It was perfect. It came out beautiful. Nice they look. They look very natural.
Well, thank you for the comment. I was very nervous because Dr. Saul was seeing my surgery, but I did as I usually do.
You did a great job.
Thank you so much. When did you see the dissection? Was there a lot of bleeding?
No bleeding, not even minimal, no bleeding. That's what I liked about it, is because blood could be an agent. Every time you irrigated, it came out clear. It was perfect. You took your time and did it beautifully.
For the viewers, why is bleeding, less bleeding is important for the breast augmentation outcome?
Because it's an irritant for the body and the implant, and that's one of the causes, questionably, that they could cause capsular contractures if you have bleeding. So you want to have minimal to no bleeding to not have any inflammation in the pocket and thus not have any capsule. I think the most, that's one of the things I like to do in my surgeries is that I sit them up like they're sitting at a table on a chair, so you could see really gravity working and you can do better dissection and better evaluation of the implants. And I do that maybe 3-4 times in a case.
Oh, wow.
Yeah, because I do it when I put in the sizer, then when I put the implant, and one last time when I'm closing up to make sure everything looks perfect.
Yeah, that will be more perfection, I think. That will help more better shape. I'll keep in mind with that tip. Yeah, with you. During your practice, is there any tips for less bleeding?
Taking your time in dissection and everything, being cautious around the muscle area is advantageous. I think, going subfascial is going to have less bleeding when you don't go underneath the muscle, because sometimes when you're going under the muscle, you got to be careful that you're right between the pec major and pec minor. You have to have that beautiful plane, and when you dissect and go dual plane, you got to be cautious when you're releasing the muscle.
Yeah.
So, it's just being attentive and taking time.
I think, when we dissect between the major muscle and the minor muscle, sometimes there's extra vessels or perforator coming out. So that causes a lot of bleeding and also delays the operation time.
Absolutely.
So, like you mentioned, precise dissection is essential for better outcome and also the softness of the breast.
Absolutely. I like the way that you had been marked before and you stayed within the line of your dissection was perfect within the lines you made preoperatively. That was impressive.
I was very impressed because Dr. Saul helped me to see the contour. When we are estimating the size, he wanted to have the patient posture more at the standard posture and try to estimate the pose difference. Would it be helpful if I do lectures to doctors in the United States for this kind of technique?
Sure, because it's a newer implant and we don't have as much experience as someone you did, as someone like yourself, which you've done many more motivas than we have in the US.
And also, I think non-destructive dissection is very helpful for women, especially for the health. You also think?
Absolutely. You don't want to disturb places where you don't need to. You don't want to cause irritation or inflammation. You want to be precise and go to where you need to go, do your surgery, and get out with minimal disruption. Absolutely.
Wow. Thank you for your time and thank you for coming here.
I'm honored to be here. I appreciate it. You're one of the leading users of Motiva, and we could learn a lot from each other. So thank you for having me.
Thank you so much for today.
Absolutely. Thank you so much.
I really appreciate you coming over to my clinic and having this interview.
You have a beautiful clinic. It's first class all the way.
Thank you very much. I'll see you in the United States later on.
Absolutely. Please come visit us in Beverly Hills.
I would love to. Yeah. See you in a day.
Thank you.